Every day, your kidneys quietly filter your blood, removing waste and balancing fluids and minerals, almost always without you noticing. That's actually part of what makes kidney disease tricky. Brain fog that won't lift, ankles that swell by the end of the day, ongoing fatigue, or getting up repeatedly at night to use the bathroom can all be early signs that your kidneys need attention. But they're also signs of plenty of other, less serious things, which is exactly why they're easy to dismiss. I want to start with the single most important thing I can tell you in this video. If you're noticing several of these symptoms together, the right next step is a simple blood test that checks your creatinine and estimated GFR, and a urine test that checks for protein, not a spice cabinet ritual. These tests are inexpensive, widely available, and they're the only way to actually know what's going on, because kidney disease in its early stages often has no symptoms at all, which is part of why more than 37 million Americans are living with it, many without knowing. I'm here with Human Health Zone, and today we're going to talk honestly about 6 common kitchen spices that come up constantly in kidney health content online, what real research actually says about them, where the evidence is genuinely thin, and one important safety caution that gets left out of almost every version of this video you'll find. If you've had a recent kidney function test, share that in the comments, since talking openly about preventive testing helps normalize it for others watching. And if this kind of honest, careful health content is useful to you, consider subscribing. Let's go through these spices with real context. Garlic has reasonably good evidence behind its cardiovascular benefits, including modest effects on blood pressure in some studies. And since high blood pressure is one of the 2 leading causes of kidney damage over time, anything that genuinely supports healthy blood pressure is relevant to long-term kidney health indirectly. That a real, if modest and indirect connection, not a direct effect on kidney filtration itself. Cumin, ginger, cinnamon, and coriander seeds all contain compounds with measurable antioxidant and anti-inflammatory properties in laboratory research, and a generally anti-inflammatory diet is reasonably associated with better long-term health outcomes broadly, including cardiovascular and metabolic health that indirectly supports kidney health. But I want to be precise about something. Laboratory and animal studies showing antioxidant activity are a meaningfully different and much earlier stage of evidence than a study showing these spices change human kidney function markers. And I could not verify research showing that culinary use of these spices measurably improves creatinine or other kidney function tests in people with kidney disease. If you see that specific claim made elsewhere, treat it with real skepticism. Quick disclaimer in the middle of this video. This is general health information, not personalized medical advice, and it absolutely does not replace kidney function testing or guidance from your doctor or nephrologist, especially if you have diabetes, high blood pressure, a family history of kidney disease, or any of the symptoms mentioned earlier. Now, the safety point I mentioned, and this is genuinely important if you've seen turmeric recommended heavily for kidney health, which it often is. Turmeric is one of the highest oxalate-containing spices that exists. In small culinary amounts, like what you'd use seasoning a meal, this generally isn't a significant concern for most people. But concentrated turmeric supplements, or using large daily amount of turmeric powder specifically for a kidney cleanse, can meaningfully raise urinary oxalate levels. And oxalate is a major contributor to the most common type of kidney stone. There are even documented case reports of kidney injury linked to high-dose turmeric supplementation in vulnerable people. This matters enormously for exactly the audience this kind of video reaches. People worried about their kidneys, because the well-intentioned advice to take concentrated turmeric for kidney health could, for some people, actually increase kidney stone risk rather than help. If you have a personal or family history of kidney stones, or any diagnosed kidney condition, please talk with your doctor before taking turmeric supplements specifically, and stick to ordinary cooking amounts rather than concentrated extracts. So here's an honest summary. These spices are a reasonable part of a generally healthy, flavorful diet, and some, particularly garlic, have real if indirect connections to cardiovascular health that matters for kidneys over the long run. But none of them are a kidney detox. None of them are documented to change creatinine or GFR test results, and turmeric specifically deserves caution rather than enthusiasm if you're worried about kidney stones or have existing kidney disease. The things with genuinely strong evidence for protecting kidney health long-term are well established and less exciting than a miracle spice. keeping blood pressure and blood sugar well controlled if you have diabetes, avoiding regular high-dose NSAID use when alternatives exist, staying appropriately hydrated for your individual situation rather than following a generic formula, and getting periodic kidney function testing if you're in a higher risk group. If today's video helped you understand the difference between marketing and evidence, take a moment to like it and subscribe to Human Health Zone. We aim to take your health and your time seriously. If you found this useful, share it with someone who might see kidney detox content online and benefit from a clearer, more honest picture. And if anything in this video resonated with symptoms you've been noticing, please consider a nudge to ask your doctor for that simple blood and urine test. Not a reason to wait. We'll see you in the next one.